My name's Dyfrig Hughes and I'm Professor of Pharmacoeconomics at Bangor University in Wales. I'm here to talk about health technology assessments. This is a process by which new medicines are assessed for how effective they are clinically, how cost effective they are, and how they represent value for money to reimbursement agencies. Health technology assessment has had a long history and it's a key part of the process of making medicines available to patients. The first part of a health technology assessment considers the evidence in relation to the clinical effectiveness of a medicine. This often relies on clinical trial data, but also real-world data to indicate whether a treatment is clinically effective in the place of care. Following on from clinical effectiveness, we would often evaluate the medicine to see whether it represents good value for money. And we do this by applying economic evaluations. A typical approach is to estimate the cost to the health service and benefits to patients, often expressed in terms of quality adjusted life years or QALYs. And many countries use this cost for quality framework to determine whether a medicine is cost effective. Within GENEGUT, where we're developing an RNA-based therapy for the management of Crohn's disease, we're interested to see whether this new treatment would be cost effective to healthcare payers. And to do so, and given that GENEGUT will not have any clinical data available, we'll have to develop a modelling approach. This involves a mathematical modelling to bring together data around the potential for the new treatments to be effective. But also we are asking experts, that is gastroenterologists from across Europe, to get their views about the place of this therapy within the care pathway. But also we will ask gastroenterologists about what they would consider to be an effective treatment. We'll use all this data to identify what might represent a value-based price. In other words, a price for the medicine that would make it cost-effective to the healthcare system. A further aspect of GENEGUT is to do market projections so that we understand the impact that the treatments may have across different jurisdictions. And we'll do this by calculating the incidence and prevalence of Crohn's disease, and then calculate what proportion of eligible patients would perhaps receive the RNA-based treatment.